with our team about the presence of herpes virus infection within the inflammatory cells. Then we started looking at the white blood cells, inflammatory cells, to see which one is where, basically. And then we presented our data. And that's the data, basically. We checked with T lymphocytes, B lymphocytes. And again, we realized that there are small number of viruses that they may be harmful to human beings. Again, such as human cytomegalovirus, Epstein-Barr virus, human herpes simplex virus, V6. Now, after that, we identified some research models, like kidney transplant patients. Purposely, we kill their immune system, so kidney is not rejected. So that's a good research model. The immune system is off. Or Down syndrome patient, trisomy 21, the immune system is defective. That's a good research model, versus going after regular population. Or Guillain-Barré syndrome. And again, in those patients, we identified viral activities plus bacterial activities, and whether or not there was a collaboration between the two, whether or not they communicate with each other. Now, it's interesting when it comes to trisomy 21 or Down syndrome patients. In 1929, they would live average like 9 years, and then it goes up to 12, 20, 35, but today, they're living for 60 years. And again, interestingly, even with that research model, we realized that mostly it's about cytomegalovirus activity when it comes to viruses. Then we went to Vincent Hospital. We identified a significant number of patients that they had kidney transplants. We followed them to see whether or not those viral activities are going to cause kidney rejection, basically, the failure of transplantation, and that was the case. Whenever we were seeing some kind of rejection, we could see some viral activity. And at that time now, we had the technology to evaluate viruses based on their activities, not only the presence of DNA. And I'm talking about messenger RNA. And then with our team in Colombia, Dr. Botero, Javier Botero, and Adolfo Contreras, we checked so many different countries in South America, and we realized that they have a very high prevalence of periodontal disease, but again, not too many microorganisms are involved. We did the same thing. We checked different countries like China, Taiwan, India. And these are some of those patients that basically that we were interested to study, similar to these situations. Interestingly, I traveled to Israel, and in Israel, especially in Ashkelon, we saw a very high prevalence of disease, surprisingly, similar to what we see in Morocco, similar to what I had seen in Egypt. But again, when we checked the microorganisms, always a small number of microorganisms, they were involved in the disease process, not all of them. That's a well-known study which was published by our friends in Israel, and they also reported a very high prevalence of disease related to those bacteria, even in Israeli army. And as you can see, the affected people, it can go up to 5.9% of the soldiers. And this is another study coming from our friends, Dr. Stables and his team from Israel, and they were checking those, the families, that they live in communities. Usually, they do not like to go to hospitals. Basically, they are very much within their communities. And they reported a very high prevalence of disease with that community as well. But again, a small number of microorganisms, they were involved. Now, then I went to Egypt, and interestingly, I was interested in Hatshepsut, a great pharaoh Egyptian who was living more than 3,000 years ago. She's a woman. We have 7 pharaoh women in Egypt. She's one of them, probably she's the brightest one, with Ramses II. At her time, we have free education. She's a great warrior, but at the same time, she ensured peace in Egypt. But what she did for education and science is just breathtaking. And equality between men and women. And that's her temple, which is completely intact. And interestingly, she died because of a periodontal disease. You can see severe bone loss with her molar. Now, I was following some of these microorganisms in different countries. And similar to other groups, we reported that there are, again, a small number of microorganisms that are responsible for the disease, not all of them. You know, every day you are exposed to infection. Why we don't die, like your skin? Because we have thousands of microorganisms that are protecting you. Your immune system is not your first line of defense. Microorganisms are. Your eyes, they are humid. But why we don't get infected every single day? Because the microorganisms on your face, on your eyes, they're protecting you. And again, our first line of defense is not the immune system or these microorganisms. So why we go after all these microorganisms? Why we are using so many of these antibiotics, so many chemicals? Even in our medical schools, we teach our residents to hate microorganisms, and that has to change. We really teach them to kill our best friends. And if one day we are going to be successful, we are going to cause lots of problems. And then with the leadership of Jean-François Michel in France, is a teammate of mine, we put together a team of 100 people. They were all volunteer in the Philippines, and we checked the kids that they had no access to medicine, basically. They were sleeping in the streets. The paper was published, and we had the permission from the government. That's the kind of place they were going to feed themselves, basically, those kids. No father, no mother. So that could be a good research model at the same time. And we asked them to use sea salt, basically. Sea salt, basically, because we had generated a hypothesis that can we find something that is not going to kill the microorganisms, but just neutralize their toxins. So basically, our team, we came from this angle that we have to stop killing microorganisms. We have to stop hating them, basically. But if we are going to target anything, it has to be targeting their toxins. Again, some of those kids, you can see them here. I mean, they were violated, they were hungry, they were sleeping in the streets. And the paper actually that we published is called The Street Children of Manila. And we followed them for 10 years. So now the kids that they were 5 to 12, then the 5 was 15, 12 was like 20, 21, 22. We followed them in time, and surprisingly, in the absence of money or family support, we could not identify any more disease, at least within their oral cavity. Of course, we checked the cytotoxicity of this sea salt to make sure it doesn't have any cytotoxicity. In our research team in Bordeaux, in France, we isolated embryonic fibroblasts that are extremely sensitive, and we exposed them to sea salt, and surprisingly, there was no cytotoxicity. And that's really extremely sensitive cell, this embryonic fibroblast. So it was very much encouraging. These are the kids that's... Then my partner, Dr. Leslie Levine, many years ago introduced me to Dr. Maddahi. Dr. Maddahi, we had a meeting in my office, and he heard about all these research projects, and he became interested to continue that. And I told him it's very expensive. We had done lots of work with a wonderful team, but if you want to continue, you really need a much, much bigger team. And he was so generous to provide it and to get involved with the team. So I'm going to ask him to continue with this presentation so you would see where we are, basically. But just to make the long story short, we have to stop killing microorganisms. We have to stop hating them. They are really our best friends. Actually, indeed, we are microorganisms ourselves. Your digestive system, packed with microorganisms, is making vitamin K for you. Dopamine or serotonin, epinephrine, we would not have them if we did not have all these microorganisms. So whatever we are using, whether it's a soap, all these chemicals, all these toothpaste, they go into our system, they go back to rivers, and they go to the oceans, and they will come back to chase us. So I'm going to ask Dr. Maddahi, my partner in these research projects, to continue with the presentation.
Hello, good morning. One of the best things about Dr. Nowzari is that he can summarize 20 years of research in 5 minutes. It's unbelievable. So I'm going to give you a little bit of a background. I've been a dentist for about 33 years. And in the 33 years, after 25, 26 years of being a dentist, I got also frustrated with the products that I was using for my patients. I kept seeing problems over and over in my own practice with inflammation, bleeding gums, dry mouth, all sorts of things. So when I was looking at all of this, and through this frustration, I again contacted Dr. Nowzari. I said, you know, there has to be a better way. As a periodontist, as someone who's been the chairman of the perio department at USC, what are you suggesting to your patients? And his answer to me was actually very surprising. It was sea salt with water. I said, really? As a periodontist in Beverly Hills, that's what you're telling your patients to use? He says, yes. And I said, you know, growing up, I've always had heard of using sea salt, gargling with sea salt. My grandma, my mom, everybody talked about it. But what is the scientific research behind it? And what he told me about was the Manila study. And as I studied the Manila study, I become so fascinated with such a simple, natural element that can do so much. So we started to talk as to how can we actually develop a product for different conditions. Now, for those of you who are ever thinking of developing a product, this is my suggestion. There is a running joke. What is the fastest way to become a millionaire? Is to start a company as a billionaire. The amount of time, the amount of money that's needed to actually create something is unbelievable. And that's something that Dr. Rambari was referring to. For 27 years, he's been trying to figure out the money to actually accelerate his research. So first, I'm going to start with certain facts about the bacteria or the microbiome. Microbiome was what Dr. Nowzari was referring to as the microorganisms that are in or on our body that have a symbiotic relationship with us, but they act as something that's protecting us. What people don't know is actually we are made out of bacteria. The number of bacterial cells in our body is 100 trillion bacterial cells to 10 trillion human cells. So it's a 10-to-1 ratio. Fact number two, what these bacteria do, they do various different things. One of the things that we're most familiar with is digestion and what the microbiome is doing in the gut. But actually, they help with the production of vitamins. One particular one, vitamin K, which is the main vitamin for coagulation. And then there are also, they produce the neurotransmitters dopamine and serotonin, which affects the mood. So when you look at on your skin, the microbiome is on your skin as protecting you. So again, the first line of defense is actually the microbiome. It's not the immune system. Okay? Then we go into where are these microbiomes? And there's a different percentages of them. 1.6 is in the eye, 10% is in the nose, 6.5% of these microbiomes are in the mouth, 29% are on the skin, 32, which is the largest population, is actually in the gut, and then the 20% is in the urogenitalial tract. So we go to a concept which is the hygiene hypothesis. So when we go back to 1950s, we're talking about infectious diseases, and people were dying from infectious diseases. So the whole advent of antibiotics and killing bacteria and saving lives was key. So as that started to take place, where that we were killing the bacteria that's causing the infectious diseases, you see a dramatic drop in rheumatic fever, hepatitis A, tuberculosis, mumps, measles. But somewhere along the way, we also started to treat every bacteria as a harmful bacteria. And we went over the edge of being too clean, too sterile, and killing everything in sight. So today, if you look at it, if you look at the dishwasher soap, most likely has some sort of a an antimicrobial ingredient in it, which is, again, a form of antibiotic. Washing machine soaps have some sort of an antibacterial in it. Hand soaps have some sort of antibiotic in it. So our body is being inundated with these types of antimicrobial products. Also, definitely in the United States, in the meat that we eat, there is antibiotic as well. So that antibiotic is also affecting what the type of microbiome that we have in our gut. So let's get into what is the difference between contamination and infection. I think that's what's the most important aspect of it. Human beings have never been in a sterile environment. They could not have survived if they had to be in a sterile environment. The immune system is actually needs the different type of bacteria, especially at an early age. As Dr. Gambari was referring to, a child in Iran is getting a taste of different food at an early age. That's how the immune system is building up. There is a certain amount of truth in all of this. So the more you're exposed to these types of bacteria at an early age, the better your immune system is going to be. And the more you are exposed to sterile environments, more of the possibilities of autoimmune diseases can come about. So infection is when we need the antibiotic. When we are contaminated, we do not need any antibiotic. And we are contaminated all the time. At all times, we are contaminated. But the body knows how to act with this contamination, that there is no bad effect on you. You don't feel sick, there's nothing going on. But you have all sorts of bacteria, viruses, even Ebola is in all of us. But somehow it's not affecting us in any way. So we go back into the mouth. And what we have found is that the different research has linked what's happening in terms of the periodontal disease, gum disease types of bacteria in the mouth have been linked to different heart disease, kidney disease, diabetes, Alzheimer's. There was a recent article with regards to a bacteria that causes gum disease, which is called P. gingivalis, and the high levels of P. gingivalis in the brains of people that have Alzheimer's. Are these all conclusive? I'm not telling you that it is all conclusive, but there is research that's showing certain linkages between these type of bacteria that are in the mouth and how it's impacting the rest of the body. So when you look at the oral care products on the market, what's being advertised? The selling point kills 99.9% of the germs. That's what's being advertised on the mouthwashes, on the toothpastes. So why is that? The main issue is that cavity is caused by bacteria. Gum disease is caused by bacteria. Bad breath is caused by bacteria. When he was talking about the homeless kids in Manila, they were infected by a particular type of bacteria called the AA bacteria, and the disease was due to the bacteria. So the whole concept in the past 70 years of dental research, dental education, and dental practice has been to kill the bacteria. But this concept is flawed. Why is it flawed? Because we know we cannot kill all the bacteria. If this concept was true, nobody should have cavities, nobody should have gum disease. If you're killing 99.9% of these germs or bacteria, nobody should have. There should be no dentists. No dentists are needed. There's no cavities, there's no gum disease, there's nothing. So why doesn't that work? Why that doesn't work is that we know when you use any type of antibiotic, after a while, the type of bacteria that are there become resistive. So there was a landmark FDA ruling on soaps and body washes in 2016. And what that research showed is that the soaps and body washes that use antimicrobial ingredients, there was a list of 13 of them. One famous one is triclosan, which is also in Total, Colgate, and things like that. There is a problem with using these ingredients, and they started to get banned. And the premise was based on three things. What is the difference between a normal soap and an antibacterial soap? On the research studies that were conducted, they showed that there's no significant difference between using a regular soap or using an antimicrobial soap. Number one. Number two, what is the effect of antimicrobial soaps and those antimicrobial ingredients on the body? And what they found out, there are endocrine disruptors. So the endocrine gets disrupted by these types of ingredients. And number three, long-term use of antimicrobial ingredients causes resistive bacteria that can be transferred. So imagine you're in a house, someone is using products that have antimicrobial ingredients in it, one person isn't. The person who is will develop resistive bacteria that can be transferred to the other person who is not using it. Okay? So the whole basis of the research and figuring out a product was based, again, back to this particular study. I think this study gets overlooked. It's a 10-year, it's an unprecedented study of you looking at homeless kids that are infected with AA bacteria. And the AA bacteria, what it is doing to them is that they're losing gum and bone around the 4 upper, 4 lower front teeth and their back molars. He showed the slides of these kids. And what was so amazing about it is that Dr. Nowzari and the team asked them to rub sea salt on their gum, follows them for 10 years. The disease has stopped, but the AA bacteria continues to be alive and well in the mouth. So this is the idea that it cannot just be the harmful bacteria that's causing the problem. There's something else. Because the AA bacteria continues to be in the mouth, yet the disease has stopped. How can that be? So his hypothesis at the time was, it's not the bacteria, it's the toxins of the bacteria. And the toxins of these bacteria are well known. We know exactly what is the toxin of a P. gingivalis, Streptococcus mutans, or the AA bacteria. That's not the question. But all of these products, what they're doing, they're saying, oh, we're just going to go kill the bacteria, and then there's no toxins as a result of it. The flaw was resistive bacteria, number one. Number two, when you go and you kill also the harmful bacteria, which are the gram-negative bacteria, they also, by killing them, you release toxins in the mouth. So I started to look at different salts and to find out if there is an actual better salt than the sea salt that he was using in his study. So when you're looking at different salts, we're going to give you a little minor summary of the different types of salts that we use. So the one that we use, the table salt, is pretty much 98% salt, 2% minerals. The sea salt is about 20% minerals and 80% salt. Himalayan salt is 40% minerals and 60% salt. Dead Sea salt has 86% minerals and 14% salt. The mineral content of this salt was very, very important because, again, when we're talking about mouth, when we're talking about teeth, teeth is made of mineral as well. So let's review what is the problem with the current oral care products. Number one, they're all bactericidal. Their whole goal is to kill bacteria, is advertised. That's what they're trying to do. They're not trying to do anything else. Now, when you look at American Dental Association, they are willing to give you their seal of approval if your product contains antimicrobial ingredients. If it does not kill bacteria, you are not allowed to get an ADA seal. So part of the reason why all of these companies are going toward killing bacteria is also that is part of the goal of ADA, because they haven't found anything else that can actually not kill bacteria but also neutralize its toxins. It's not a known fact of how this can be done. So the best way is just to get rid of the bacteria and show that you can get rid of plaque, you can get rid of inflammation, and you can then get rid of the disease. So the second part of the problem is that in the current oral care, there are ingredients that are cytotoxic. So that means it kills healthy human cells. And some of them, SLS, which is a sodium lauryl sulfate, is the foaming agent that is used in toothpaste. And the DNC yellow, F&D blue are the colorings, artificial colorings that are added to the different mouthwash. So the first thing I didn't understand why was that if we want white teeth, why do we add artificial coloring to the mouthwashes? It just made no sense. And why are we using denatured alcohol in our mouthwashes if we are worried about cancer, where the oral cancer, part of the reason for oral cancer is alcohol and tobacco use? Why are we using alcohol into the mouthwash and telling people to constantly rinse with these types of products? It's confusing. So we started to put together an actual way of how do we come up with something that has all of the best of everything. So first of all, the product should be non-toxic. Okay, so how do you prove a product is non-toxic? Whatever ingredients you use in the product, Dr. Nowzari knew a government lab in France which has the highest level of standards in testing for toxicity. It's called LEMI Lab. Whatever products are being developed, we would send it to that lab for toxicity studies. And the toxicity studies are done on the embryonic fibroblast cells of the mice to make sure that sensitive cell is not being harmed by the product. So, non-toxic. Second thing is that we wanted to make sure that the product does not kill any bacteria. This is, again, very, very controversial type of a topic because we have now been banged in our head and we've been brainwashed we should kill bacteria. We are going opposite and we want to prove that we don't kill any bacteria. So there were 5 different strands of bacteria that are prevalent in the mouth. We took those and we did laboratory studies to prove that none of these products actually kill any bacteria. So the entirety of what's going on in the mouth can be divided into 4 different concerns. Either people are concerned about their gums and some sort of decay, either they have dry mouth. Now this dry mouth that I keep talking about is the next epidemic in dentistry, partially because the number of drugs that are causing dry mouth is growing every day. So if you go on the CDC, Center for Disease Control site, and look at the medications that cause xerostomia, which is dry mouth, is now up to 450 different medications. The biggest one that starts with is the psychiatric drugs, which are for depression, anxiety, are the top, but blood pressure pills, diabetic pills, all of them have this type of a side effect that's not being communicated to the patients. Patients don't know the side effect of those drugs is dry mouth. Part of the problem with dry mouth is that our saliva is the natural antibiotic that we have, that we produce. When there is not enough saliva being secreted, the cavity-causing bacteria starts to go rampant in the mouth. It spikes up. Now, the counterintuitive thing is that when you drink water, you constantly have dry mouth, you drink water, the situation actually gets worse. Why? Because the little saliva that you actually have gets diluted by the water. Water doesn't do anything in terms of prevention of dry mouth. It just makes you feel like your mouth is moist. But it doesn't cure anything. And without the saliva, then you get more cavities. And the more cavities that I'm talking about is uncontrolled. Every 3 to 6 months, the person goes to the dentist and they have new cavities. They have good oral hygiene, but they still get cavities. And I am seeing more and more of these types of patients in my practice, and I couldn't quite figure out what was going on. And until I figured out what was happening, either the person is a mouth breather, or they have allergies, they can't breathe through their nose, or they're on medication. Now, why is the medication getting out of control? Is because certain medications are not being taken on a daily basis by younger kids. 20 million kids take either anti-anxiety, antidepressant medications. So from a young age, they're on this medication on a daily basis. If you take Advil every single day, you will end up with dry mouth. The reason being is that there's a neurotransmitter in the brain called the acetylcholine that's being affected by these medications. The list actually is very alarming. Oh, I'm going to go back. So dry mouth, and then we're talking about teeth sensitivity, and great portion of the teeth sensitivity that's there, a small portion is the gum recession, root exposure, enamel erosion, but a big, huge part of it is also the whitening products that are being used since 1982-83 because of using hydrogen peroxide in different whitening systems, but more importantly, in the mouthwash, in toothpaste. So on a daily basis, people are using products that has hydrogen peroxide that is increasing the sensitivity in their mouth. And also, nobody wants to have yellow teeth, everybody wants to have white teeth. So these are the 4 different categories of concerns. So what we did was I contacted, the great thing about Dr. Nowzari, as you saw how he presented 20 years of research in 5 minutes, I would call him and I would ask him, I want to design a study to go head to head with the major brands in the market. How would we go about designing this study? And within 5 minutes, at the most 10 minutes, he would tell me exactly how would we go head to head and do these types of studies with another product. And then I also met someone at UC Irvine that she has a laboratory there within the university that can do independent university studies on dental products. So I teamed up with her, and we started to give her the different products that we have developed. One for the anti-inflammatory, so getting the plaque to go down, inflammation to go down. And we went head to head with Peridex, which is the only FDA-approved mouthwash on the market because of the particular ingredient chlorhexidine which is in it. But the problem with chlorhexidine is it stains the teeth, it's acidic, it can affect the taste buds, you cannot use it for a long period of time, but that's what the study we did because that's the gold standard in gingivitis. And what we showed in this published study was that we work as well as Peridex. We reduce plaque by 30%, we reduce inflammation, we reduce bleeding. Yet we're not using chlorhexidine or any other chemicals that are cytotoxic. The person can be on these products forever and there would be no adverse effect. Second study, we were talking about dry mouth. The gold standard in dentistry is biotin. And we went head to head with biotin, and we found patients that were suffering from dry mouth, and usually they produce less than 2 milliliters of saliva in 2 minutes. So that's the kind of population that we're using. So, and we're doing the study that they're using this product or the biotin, and we then measure the amount of saliva that's being produced. And biotin was able to get to 5 milliliters for every 2 minutes, which is the normal range, and we were able to get about 5.5 milliliters of saliva in about 2 minutes. The next one, we went in terms of dental remineralization against Sensodyne. So Sensodyne is using fluoride to remineralize teeth that are weakening, and we are using Dead Sea salt minerals instead of the fluoride to see what is the effect on remineralization of teeth. So extracted teeth are being put into acid, and then they're being also dipped into either our product or Sensodyne. At the end of the study, we find that the enamel has gotten back with no statistical significance with the one that was not dipped in acid, but there is no statistical significance with our product versus the product that is Sensodyne. So we again went after another way of not using fluoride, but showing that there are other minerals that can be used. Last but not least, the one that is most people are interested in is our whitening products. The whitening product could be a whitening mouthwash, whitening toothpaste, or whitening strips. And we did multiple studies, and we went head-to-head with Crest 3D whitening, and we showed that we have similar whitening effect without use of peroxide. So they're all naturally derived ingredients, number one, non-cytotoxic, non-bactericidal. But what was missing was the whole theory of toxins. So because people started to ask me, okay, so your products don't kill any healthy cells, they don't kill any bacteria, they're as good as the major brands, how do you do it? How is this possible? And all I could say, and Dr. Nowzari was saying that there is a theory that we are neutralizing the toxins of this bacteria. It's a theory. Now, believe me, it took 4 years to prove this particular point because it was so difficult to do toxin studies. I contacted the head of microbiology department in different universities, and doing toxin studies, they all said, oh, what a great study, but I don't know how you would do this. I was so surprised as to why that is, because they're using products that are killing bacteria, so there is no toxin studies in those type of studies. The product goes in, kills the bacteria, gets rid of the toxin, so there's nothing left to study. They're not looking at over time, the bacteria is alive, but yet the toxins are slowly going away. And on top of it, you have to duplicate what is going on in the mouth with the saliva, with the different bacteria, and then measure toxins and then see the effect of these products. So finally, we found a lab that promised that in a matter of 3 weeks can give us the results of the toxin studies. Do you know the toxins? Yes, we do. Do you know where to get them? Dr. Nowzari said, no problem, we know exactly where to get them. Oh, within 3 weeks, I'll give you the results. 9 months later, we're still going back and forth, trying to figure out how to do this study. But as recent as 2 months ago, we finally completed all of the studies on the bacterial toxins. So the bacterial toxins that I'm talking about, one was the toxin from P. gingivalis, which causes the gum disease. And what we showed, we are able to neutralize 90% of that toxin in a matter of 6 months. So the product is being used on a daily basis, and slowly, the bacteria is still alive, but the toxin starts to go down. So the key to oral hygiene health is that you have to do something on a regular basis. So in all of our research studies, believe it or not, the washout period, that means if you're using one product and then you want to test another product, you let the patient not use the product for 1 week and you start the new product, the total bacteria in the mouth has changed already. So when you don't use something, even for 1 week, the effect starts to go away. That's how quickly these bacteria are duplicating, replicating in your mouth. So that was the first one we actually showed with the P. gingivalis. Then we went after the leukotoxin toxin of the AA bacteria, which are the same type of bacteria that infected the homeless kids in Manila. And we showed also that we neutralize about 84% of that toxin over a period of 6 months again. And then we went after the enzyme that is being produced by the Streptococcus mutants, which are responsible for cavities. And again, 90% of that toxin is being neutralized without harming the streptomutants. And then the last but not least is the endotoxin, which means that you're killing the harmful bacteria, and by killing them, you get toxins released. And we found that we are neutralizing 50% of the toxins of those types of bacteria that are being killed by whatever you're eating or drinking or anything else that might have any type of an antimicrobial effect in your mouth. So we come back non-toxic, non-bactericidal, and neutralizes the toxins of harmful bacteria, these are the particular bacteria that we studied that were key to what we were trying to do. So the products have no alcohol in it, no artificial color, no preservatives, and then they have a combination of essential oils and Dead Sea salt, along with different other oils that are responsible for doing specific things in specific conditions. So what I mean by that, in terms of whitening, there is a coconut oil, sage oil, lemon peel oil that's been added to the mouthwash, toothpaste, and the whitening strip that whitens the teeth. In terms of dry mouth, it is the grapeseed oil along with coconut oil and cayenne pepper oil that increases the saliva flow. In terms of sensitivity, is the doubling of the amount of Dead Sea salt minerals in the product. And what we have found is that the minerals get coated on the surface of the teeth. That's how the sensitivity starts to go down. And these are the products that has been now developed, and they are in about 1,300 stores and growing. But the whole concept is a sort of a counterintuitive, goes against all of these research studies, but comes back to the single thing that Dr. Nowzari mentioned, protecting the microbiome. We know this already, that there are gut problems due to the destruction of microbiome. People that have any gut problems, they know this fully. We know that on the skin very well in terms of how we should protect the microbiome, but there's not enough attention being spent on oral microbiome, which is as important as everything else, because actually your digestion starts in the mouth. Thank you so much. I appreciate it.